20 years of innovation, industry leadership, and superior quality products have made Restorative Care of America one of the world's leading manufacturers of innovative restorative care products. RCAI, setting the standard in orthotic technology. RCAI products are handcrafted in the United States, using processes and materials that ensure they will last. Tested in leading teaching hospitals across the country, these prefabricated orthoses are easy to apply and easy to maintain. They're made of a heat-moldable thermoplastic for custom modifications and are available in a variety of models and sizes. The Phase 2 Multipotus is a static adjustable ankle-foot orthosis that can treat multiple lower extremity complications due to traumatic injuries, chronic disease, and resulting immobility. Patients with head injuries, spinal cord injuries, neurological problems, or post-CVA are often afflicted with severe plantar flexion contractures, muscle tones with spasticity, and inversion or eversion of the foot and ankle. Effectively treating one or a combination of these conditions can be costly and difficult. The Phase 2 Multipotus can be an economical alternative to the labor and material cost incurred with serial casting or repetitive splinting. Constructed of a durable, lightweight thermoplastic, the Phase 2 Multipotus extends from the posterior side of the calf to the plantar surface of the foot. It curves outward at the heel, eliminating pressure on this bony prominence, enhancing effective treatment of heel pressure sores. Two metal adjustment rods running parallel along the sides of the Phase 2 provide static progressive positioning for the foot and ankle. The adjustment rods range the Phase 2 from 40 degrees of plantar flexion to 10 degrees dorsiflexion in 1 degree increments to assure optimum patient rehabilitation on a daily basis. The anti-rotator bar located at the back of the Phase 2 can be extended outward to prevent internal or external hip rotation. The toe post relieves pressure off the toes and prevents toe contractures. Two Phase 2s in conjunction with a spreader bar can be used to achieve and maintain controlled abduction up to 35 degrees. The Phase 2 Multipotus was skillfully designed by a certified orthotist. With proper use, it can be a valuable adjunct to your rehabilitative program. Before applying the Phase 2, set the adjustment rods to the desired degree of angle. This is done by turning the dials on the rods either clockwise or counterclockwise. Each revolution of the dial will change the angle by approximately 1 degree. The Phase 2 is factory preset at 0 degrees or in neutral position. Turning the adjustment dials counterclockwise will increase the angle of plantar flexion up to 40 degrees. Turning the adjustment dials clockwise will increase the angle of dorsiflexion up to 10 degrees. It's important to change the degree of angle on the adjustment rod simultaneously or within 2 to 3 degrees of each other. Adjusting one side to a larger degree than the other can cause the adjustment rods to torque, immobilizing the bracket. At the initial stage of the treatment program, it's recommended to accommodate the contracture, gradually decreasing the angle through range of motion therapy and patient improvement. It's recommended that you remove the Phase 2 before readjusting the orthosis, as the force of the contracture could make adjustment difficult. If you experience difficulty adjusting the Phase 2, rest it face down on a flat surface and apply mild pressure at the heel area. This should allow you to easily adjust the orthosis. Now you are ready to apply the Phase 2 on the patient. First, arrange the Velcro straps out of the way. Flex the patient's knee and lift the lower leg. Allow the weight of the leg to seat the sole of the foot in full contact with the bottom of the splint. Place the Codell tongue padding over the instep. With one hand, maintain pressure on the instep pad, while using the other to smooth the anklet over the pad. Then, fasten the middle strap of the anklet. This step is extremely important. If you release pressure over the instep before the middle strap is secured, or if the instep strap is not the first strap to be fastened, the patient's foot will not be seated correctly in the splint. After the middle strap has been fastened, release the pressure on the instep. Fasten the calf strap next, and then the 2 remaining foot straps. The correct order in fastening the straps is the instep strap first, followed by the calf strap, and then the 2 remaining foot straps. Check the position of the patient's foot. The sole of the foot should be in contact with the bottom of the splint. There should be adequate clearance below the heel and at the back of the heel. If the heel is not properly positioned, remove the splint and try again. Check the tightness of all the straps by inserting 1 or 2 fingers under each strap. The strap should be snug, but not tight enough to restrict circulation. The toe post is used to keep tight bed linens off the foot and to encourage toe extension. It may be adjusted by loosening the knob on the bottom of the splint. After adjusting the toe post, retighten the dial. Hip rotation can be limited by swinging out the rotator bar. In cases where controlled abduction of the patient's legs is desired, an optional spreader bar can be used to connect the rotator bars of 2 splints. Muscle tone with resulting spasticity or inversion-eversion of the foot and ankle continued to be a rehab challenge. Serial casting or repetitive customized splint fabrication, although clinically effective, may not fall within cost-effective parameters and can mask possible complications of the procedure, such as the potential for pressure sores. Since the Phase 2 is not a cast, it can be removed for daily skin hygiene and range of motion therapy. Pressure areas, sometimes present with serial casting, can result in discontinuation of the procedure. The Phase 2 effectively reduces the risk of pressure areas, discouraging interruption of therapy. The extra wide straps and reinforced canvas liner of the Phase 2 are designed to withstand the forces exerted by moderate muscle tone and resulting spasticity. The foot is securely positioned at the prescribed angle of treatment at all times. The Phase 2 is supplied with a kit to assist in reducing inversion or eversion of the foot and ankle. The kit consists of an instep strap and a toe strap. The straps anchor around the metal adjustment rods of the Phase 2, providing sustained counterforce to realign the foot correctly in the orthosis. To apply the inversion-eversion kit, remove both straps from the package. The larger of the 2 straps is positioned around the instep of the foot and simulates a T-strap on a short leg brace. Place the padded area of this strap over the medial or lateral side of the instep as needed. Place the pad on the lateral side of the instep when treating inversion and on the medial side of the instep when treating eversion. The U-shaped area of the instep pad retains the opening at the heel for heel clearance visualization. Wrap the straps attached to the U-shaped pad around the heel area of the orthosis and over the adjustment bar at the opposite side. Note that shorter of the 2 straps is always placed behind the heel. Wrap the remaining single strap over the top of the instep and around the adjustment bar, meeting the plastic ring. Loop and lock to secure the instep pad in place. Once the instep pad is secured, check the positioning of the patient's forefoot. If the toes are incorrectly aligned, attach the toe strap around the forefoot. Place the padded area of the toe strap against the side of the forefoot requiring realignment. Note that the toe pad is always positioned opposite the side of the instep pad. Loop and lock the toe straps over the remaining adjustment bar. The Phase 2 is available in 2 adult sizes and 1 pediatric size, and offers either a Codal or Ortho-Wick liner. The liner of the Phase 2 can be removed and washed in warm water. Always use a mild detergent and never use bleach. After washing, allow to air dry or dry on low tumble cycle. Even though the Phase 2 can be cleaned, it cannot be heat sterilized. Since there is a risk of cross-contamination, the Phase 2 is intended for single patient use only. The Ambu Assist is recommended for patients in gait training or extended ambulation. The Ambu Assist gets the patient walking earlier in the recovery process, leading to a better therapeutic result. We hope you found this videotape helpful and informative. If you have any questions, call our customer service department at 1-800-627-1595.